Hello everyone, my name is Brianna Bodley and I will be your tour guide today. So to start off with, let me tell you how to get to our website. You can either type in South Central Public Health District into your search bar and click right there, that's our website. Or you can go up to here, this is the URL bar, and you can type in phd5.idaho.gov. See, it pops right up. From here, if you want to save it, you can go up to the star right here, click it, and you can make it a bookmark so that you don't have to remember the URL anymore. Now, when you first come, you'll see this banner right here. This is the one you're going to want to click on so that you can see our latest numbers. It'll bring up our main coronavirus webpage, and if you scroll down, here's a little bit of information about what people need to know about COVID-19, really basic information, and then you hit our numbers. Looking at these numbers, there are a couple of different things you might want to know. First of all, the maps here. This map up here is confirmed cases. This map down here, these are probable cases. If you ever have any confusion about what a confirmed case is versus a probable case, you just go over here. This is where our definition is. And we also have up here those numbers listed out for those of you who prefer a graph like this or a table instead of a map. These are just the monitored numbers. These are the cases that are not being monitored. And the reason they might not be monitored is because they're no longer considered infectious. If you get confused about what that means or have any questions, it's all explained right here in those definitions. Now, if there is nothing, it's just blank, that means that it's zero. This graph shows you a little bit about how many cases we've had total. The reason we like this is because it shows all of the counties compared to each other, so you can see how the virus has continued throughout our district pretty well, especially when you look at the probable versus the confirmed. This is just a really easy way to see that quickly. Now, these numbers I update every single day right around 5:30. Sometimes it's a little before, sometimes it's a little after. It all depends on when we're able to finish putting in that data for the day. A lot of that depends on caseload and other responsibilities for that day. We have other data that we also update, though. If we scroll down, I want to show you 3 other pages. First, this community information toolbox. This is chock full of resources for your community members. Graphs that they can put up on the wall, hand washing graphics, information that they can hand out, information in many different languages for those of us who have friends or family members in the refugee community or know someone who isn't getting the message and needs a little bit more help. All of that is in this community information toolbox. This orange one here, resources and guidance. This takes you to another page on our website that has the latest information from us and from the state. So this also has some guidance from Rebound Idaho, just in case that website goes down, you can still access those resources on this page. And then this top banner here, the weekly data dashboard, we'll click on that one. If you scroll down, this is a whole new set of numbers. This set of numbers takes quite a bit more time to compile. I only do this once a week because of that. There just simply isn't enough time at this point to do it more than that. But it gives a little better idea of who is getting the illness across our district. So for example, as you can see looking through this, there has been a lot of emphasis on people over the age of 60 contracting COVID-19. But if we break it down by decades, in our district, the most popular or the most common age group to get this are between the ages of 18 and 29. 200 of our cases, and this is both confirmed and probable cases, 200 of them have been people between the ages of 18 and 29. This is really an important number when you are trying to help people in that age group understand that they are not invincible and they absolutely can get COVID-19. As we go down, we see a couple of other number sets. This right here is the gender breakdown. As you can see, we have a few more females than we have males who have contracted COVID-19. Hospitalizations by age group. Definitely the most have been in our 70 plus age group. Our cases in long-term care facilities. This has been a lot of our concern here in South Central Public Health District Unfortunately, right now, every week, this number continues to rise, which is part of the reason we've really been trying to help people understand if it's in the community, it will likely make it into our long-term care facilities, and those residents are particularly vulnerable. They are a high-risk category, so we have to do everything we can to protect them. And then finally, our deaths broken up. We haven't had any deaths under the age of 50. So we've had 1 death between 50 and 59, 2 deaths between 60 and 69, and the majority of our deaths have been people who are over the age of 70. This isn't the only data right here. This is just the first page, or actually it's the second. If you come up here, you can see there are 2 tabs. We just looked at the case characteristics. You can also look at district-wide information. Now, this right here shows you what is called an epigraph. It's short for epidemiology graph. This is what our epidemiologists look at when they're trying to determine the trend in our particular areas. Now, as you can see, this right here, our epigraph, is based not on the day the case was reported, but instead the week of illness onset, or when somebody started showing symptoms. The reason for this is because as we've had a delay in tests, and that's either because the tests weren't able to be processed right away, or somebody waited to go into the doctor's office, any sort of delay in tests can skew the data later on if all we do is follow when that test was confirmed. If instead we follow when symptoms first were presented, when somebody first got that sore throat and fever, we have a better idea of when they were actually sick. As you can see, you can actually break down this graph by county. So for example, if you're in Cassia County and you want to know just the stats for your county, you can go right up here to Cassia, click on it, and it just shows you yours. You can see there are very few cases in Cassia County, which is fortunate. And one of our biggest weeks for Cassia was the week of May 3rd, when we had 4 people who started presenting symptoms. Sorry about that, there's a little blip there. If you want to go to a county that's had quite a few more cases, for example, Blaine County, this makes it a lot easier for you to see. We've had a huge rise in cases in March 15th, and since then, the case number has actually been going down considerably. Now, it does get a little bit confusing, I'm sure. If you're looking at it from the outside, it may look like Blaine County has gone down and then come back up. Just look at the color. As you can see, the color, the little bit of color gets smaller and smaller. That indicates that the case number is going down. But if you hover over it, as I'm doing right here, you can see exactly how many cases were that week. So in the week of April 19th, we had 6 people who started presenting symptoms who later were confirmed or probable COVID-19 cases. Twin Falls County has a little different presentation. As you can see, they go up a little, then down, and then up, and then down, and then up, and then down. So you can see they're not going the trajectory we typically want in an epi curve, which is up and then down. Instead, what they've done is up and down a little bit more. Instead of just one peak, they've had a couple of them. Now, it's really important to understand that this category right here, this latest week, this is the week we're in right now. So this data is not going to be complete. Even back to this right here, it might not be complete because if there has been some sort of delay in testing, for example, somebody started showing symptoms but thought they were allergies and didn't go into a doctor's office for a little while, they aren't going to have their data included until they're actually tested, and then we do the investigation and they're able to tell us, oh, I started showing symptoms May 11th. So when you're looking at this, understand that these 2 weeks right here are not necessarily complete, and we'll continue to update that as we talk to people and continue to investigate and those cases come in. These other 2 graphs, I'll just go over quickly. This is when our test results came in. And this one over here is our cumulative, both confirmed and probable cases across the district. So it's not broken up. That is the majority of the data presented here. There's just one more thing I want to show you. So after you scroll down to these numbers and you take a look, there's one more thing, one more set of data that I put together. Now I've included this on a link because there is a lot of data in here and it doesn't fit onto a web page. If you click onto it, it'll open it right up into this program called Tableau Public. That's what I've been presenting all of this data on, but as you can see, it's so wide it wouldn't fit on our regular web page. This shows you confirmed cases by date reported to our district. Now, if you're looking for a district total, you can actually go and click the district total and it will highlight it so that you can move to whatever date you're looking for and find that number quickly. If on April 26th you are actually more interested in, say, Goodings cases, you can do the same thing. Click on Gooding, go to April 26th. Oh, we had 0 cases reported on April 26th. Or say you wanted to do May 10th, 1 case reported on May 10th from Gooding County. So it's very, very simple for you to find that. Camas is a little bit hidden because we have so many counties. So if you scroll down, you can find Camas there as well. Below that, the data is represented in a line graph. So you can see Blaine County, this is the district total actually right here. You can see our biggest peak right here actually lines right up with Blaine County's biggest peak. Now, this data right here is presented individually. That means that this peak right here in Cassia County only represents 3 cases. It is not the same as the same size peak in another graph. These are all completely separate. The only reason this is helpful and the only reason this should be used is so that you can look at your county alone. So Blaine County can look at this and say, okay, here's our peak. What day was that? And if they hover over it, they can see, oh, that was April 1st, 2020. If you look in that little box, you can even look at all of the other counties on that same day. But the point in this is to see your county alone, how it was doing, so that you don't have to try to understand it compared to everybody else's. It is important to understand the data in this box right here, or these 2 boxes, are only confirmed cases. If you ever have a question about whether or not it was a confirmed or a probable case or some other kind of case, just look at the header. So you can see this says confirmed cases by date. That means it's only confirmed cases. Down here again, confirmed cases by date reported to SCPHD. If we go to some of our other graphs, you'll see that there are different headings. Confirmed and probable COVID-19 cases. And you know it's confirmed and probable. Cumulative, confirmed, and probable COVID-19 cases. So if you ever have a question, look at that header before you get concerned that you don't have the right information. Definitely just make sure that you're reading the whole graph so that you can see exactly what kind of data is presented. And if you have any questions, feel free to reach out to me and I will do my best to answer them. Or if you want to reach out to somebody else within the district that you know personally and that you've communicated with and you're comfortable with, feel free to do that and they can always pass those questions on to me. I hope that helps. Take care, everyone, and please be safe out there.